As vegetable oils are a significant part of our daily diet and have a systematic impact on our health, we should know about their nutritional value and which vegetable oils to consume and which to avoid. Fats in general and vegetable fats in particular are a very valuable component of our diet. Those who deny themselves sufficient consumption of fats, whether of animal or vegetable origin, are making a very big mistake. Despite the fact that fats are very calorie-dense, even if you want to lose weight, you should never give them up. In addition to the value of the fats themselves for the body, they also contain a whole range of biologically active substances, including vitamins. Therefore, by depriving yourself of fatty foods, you deprive yourself of a whole complex of very useful substances. If you want to lose weight, it is better to give up sweets. This is good in every sense. As for fats, over the past 10 to 15 years, many people have practically given up consuming animal fats, beef, lamb, chicken, pork fat, as well as butter, the traditional products that we have been consuming for thousands of years. This was due to the myth that consuming animal fats is associated with an increase in cholesterol levels. Today, this myth has been debunked. There is no scientifically proven relationship between consuming animal fats in normal amounts and the formation of cholesterol plaques or atherosclerosis. At the same time, many people have switched exclusively to consuming vegetable fats. In the 1970s, there was a period when, in several economically developed countries, especially in North America, people almost completely gave up animal fats. At that time, it became very popular to consume margarine as a food. Unfortunately, now, after many years, scientists have been able to evaluate this experiment conducted on billions of people. And the results of this experiment, unfortunately, are not comforting. According to the definition given by the World Health Organization, margarine is classified as trans fats, that is, products that significantly increase the risk of heart attacks and strokes. Animal and plant fats should be consumed in a balanced and reasonable manner. Plant oils contain non-saturated polyunsaturated fatty acids that are very important for our body. After all, our body also contains structures that contain lipids and fats in large quantities. In particular, nerve fibers, the membrane of each cell, and the inside of the cell structure contain fats. Fats are precursors to many hormones, cholesterol is a precursor to many sex hormones, and so on. Therefore, the contribution of fats to the diet is invaluable. However, it turned out that there are three main groups of polyunsaturated and unsaturated fatty acids. You have probably heard of them all: omega-3, omega-6, and omega-9. Excess omega-6 fatty acids can cause inflammation in humans and increase the risk of cancer, which are well-established facts. Yet, in the diets of most people, the amount of omega-6 fatty acids can be 25 times higher than the amount of omega-3 fatty acids, whereas the normal ratio of omega-6 to omega-3 fatty acids should be around 7 to 1. This means that the normal intake of omega-6 fatty acids is exceeded by 350%. This increases the risk of various diseases, including those associated with atherosclerosis. It is in the area of blood vessels where inflammation occurs due to excess omega-6 or excess sugar that cholesterol accumulates and clogs the blood vessel with cholesterol plaque. This is how the myth that cholesterol is harmful to health arose, even though cholesterol is not the original problem. Let's figure out which oils are best to consume. Let's separate three of the popular oils that are most similar in terms of their fatty acid composition. These are corn oil, sunflower oil, and rice oil. In this group of oils, linoleic acid, which is omega-6, makes up about 70% of the total composition. Linoleic acid is an essential fatty acid that cannot be synthesized in the human body and is therefore very valuable. However, excess linoleic acid can lead to inflammation. About 30% of these oils are oleic acid, which belongs to the group of omega-9 fatty acids and is not essential. Oleic acid freezes relatively quickly at low temperatures, so you can determine how much of it is in vegetable oil by putting the bottle in the freezer for a few hours and then assessing how thick the oil or its part has become. Unfortunately, the content of omega-3 fatty acids in this group of oils is only up to 1%. This equals a ratio of omega-3 fatty acids to omega-6 fatty acids of approximately 1 to 70. That is, it exceeds the normal ratio by 10 times. If you regularly use this group of oils mainly, you significantly increase your risks of the aforementioned diseases. Let's talk about oil, which is perhaps the most popular among marketers and positioned as very useful. This is olive oil. If you freeze it, it will turn into a solid fat and will melt very slowly. This is because up to 80% of oleic acid, omega-9, is present in olive oil. This fatty acid represents minimal value to our body. Although it is not a maximally fatty acid, it is entirely replaceable, and our body can easily do without it. Omega-6 in olive oil is present up to 20%, and omega-3 is almost entirely absent. From this point of view, olive oil is extremely low in usefulness. Its dietary value is very, very low. Therefore, all the hype around olive oil is inflated solely by marketers. However, a high content of such a hard-melting fatty acid as omega-9 makes olive oil an excellent oil for frying. Remember, the harder the frozen oil, the less there are non-maximally fatty acids, and the more you can fry on it. Unfortunately, the more useful oil is from a dietary point of view, in its raw form, the less suitable it is for frying. However, it is worth noting that extra virgin olive oil should not be used for frying. It is better to consume it raw because it is unrefined. And for frying, it is better to use pressed refined olive oil. It will be much more useful than frying on corn or sunflower oil. After all, it contains 2 times less omega-6 and burns and produces fewer carcinogens. From a dietary point of view, flaxseed oil is the most useful. It contains the highest amount of omega-3 up to 80%, and omega-6 and omega-9 are in a ratio of 2 to 1. Flaxseed oil can be consumed daily, in small quantities, to balance the fatty acid composition of one's diet, in combination with other oils. This will significantly reduce the risks of cardiovascular and oncological diseases. But if all this hassle with consuming raw flaxseed oil seems too complicated and requiring discipline, then try to use rapeseed oil in most of your dishes. Use it for cooking, frying, salad dressings, making homemade mayonnaise, and so on. The thing is, rapeseed oil contains up to 60% omega-9, which is close in ratio to olive oil. But at the same time, rapeseed oil contains up to 25% omega-6 fatty acids, which is almost 3 times less than in corn or sunflower oil. And up to 15% contains omega-3 alpha-linolenic acid. Thus, the fatty acid composition ratio in rapeseed oil is practically ideal for our health. There were some prejudices regarding rapeseed oil for a long time, related to the fact that old rapeseed varieties contained erucic acid and high doses of glucosinolates, substances that give mustard its pungency. Therefore, rapeseed oil underwent a fairly deep processing and was mainly used for technical purposes. Modern rapeseed varieties that are grown everywhere no longer contain erucic acid and are highly valuable in terms of diet and widely used in cooking. However, in conclusion, it should be added regarding frying. Although rapeseed oil is quite suitable for this task, if you want to fry something properly, it is better to use animal fats rather than vegetable ones. The most affordable of these fats is pork fat, lard. It contains many useful substances, including fatty acids, which are also necessary for our body, but at the same time, it practically does not contain unsaturated fatty acids. But, most importantly, never use margarine in any dishes.